Hi all, Dr. Lisa here with another review of a study on factors that affect fertility. So today I'm looking at the article entitled Rubik's Cube of Depression, Antidepressants, and Fertility. It was published on December 1st of 2020, and Amy Kaing and Eleni Jaswa were the two main authors of this paper. What they are studying is the effect of antidepressants on women's ability to conceive and the effect of antidepressants on the live birth rate, also abbreviated as LBR, because LBR is really the gold standard. It doesn't matter if you get pregnant. The question is can you stay pregnant? So investigating the effect of antidepressants on the live birth rate is a really good indicator of how much it might affect women's ability to have a baby. Up until the research on antidepressants and fertility is a little scanty. As women, however, as a greater proportion of the population is taking antidepressants to deal with issues of depression, it's become a real need to study the effect on fertility, because if it does have an effect, women need to know that going forward. I want to start with the caveat of saying that depression is a real illness. It is profoundly problematic in terms of anybody who has depression is, and is trying to struggle through it, understands that it can affect negatively every single aspect of your life. Your feelings about yourself, your ability to do things in the world, your ability to actually do your job, to have good, healthy relationships. So any conclusions about the effect or non-effect of depression drugs on fertility need to be taken with understanding that depression is a very real illness and must also be taken into consideration in terms of appropriate treatment paths for fertility, because if you're depressed, your fertility is going to be suppressed because you don't feel like having a baby, or you have a lot of self-doubt or concerns about your ability to raise a child. So that is where I want to start with this particular discussion, is that any conclusions from this study are not recommendations to stop taking antidepressants. It means a recommendation to appropriately get help if you need to with fertility. Now, up until recently, most of the studies have had very mixed results in terms of separating out the effect of antidepressants on fertility. Some of the studies says that it was a problem. Some of the studies said that there weren't any issues. So there were two large prospective cohort studies that actually said the exact opposite thing. One said it was a problem, one said it wasn't. The article that I'm looking at actually tried to parse out why the answers, the conclusions in those two big studies were what they were, and figure out what it means going forward. Often it's a classification problem, because if you are working with women who are self-reporting their use, but you don't actually know how much they're taking and how consistently they're taking their medications, you don't actually really know the effect on fertility. So one of the researchers, or one of the researchers in one of the studies, actually creatively used specimen samples to track the use of antidepressants and then correlate that with the effect on fertility, which is a much more objective, much more precise way of measuring what's going on. The result is that women with extensive use or long-term use of SSRIs had a 24% reduction in fertility. So what that means is that yes, SSRIs can reduce your fertility. But an additional important note is that using SSRIs does not increase your rate of miscarriage and does not decrease the live birth rate, meaning once you get pregnant, if you are on antidepressants, you have a pretty much normal chance of getting to the end of the pregnancy and having a baby. So that is very, very good news indeed. There is nothing linked between being on SSRIs and having higher rate of miscarriage or high rate of not making it to, full delivery. That is fantastic. That is a fantastic thing. There is indications that, in particular in this study, fluoxetine does decrease fertility. So what that means is that women who are taking SSRIs may encounter a harder time getting pregnant, which may mean that which often means translates in it's just going to take a little bit longer. Now, they only studied this in terms of assisted reproductive technology. And of course, when you're talking about IUI or IVF, there are drugs involved, and it's entirely possible that this only holds for women who are going through ART. What it tells us, though, is that if you are taking antidepressants and they are a necessary part of your daily routine because they are keeping you out of depression and keeping you functional, it is really important to continue to take them. Just be aware that it may take you a little longer than statistically normal, depending on your age group, to get pregnant. And if you're doing ART or IUI, it may mean that you have a slightly lower response rate. The good news is that once you get pregnant, there's no change in your ability to carry to term and have a baby. I want to emphasize again that depression is a very real illness, and it can completely change in a negative way everything in your life. So my recommendation would be, if you are taking SSRIs, keep yourself calm if it is taking longer to get pregnant than you think it should. Of course, everybody should always go through all of the standard, testing and just making sure that there aren't other issues that are actually creating the problem. But recognize that while it's taking a little bit longer to get pregnant, it's not going to actually affect you once you're pregnant. And that is good news indeed. Thank you much, and see you soon.